first of all. I would take some time to focus on myself. What's my perspective on race? What is my perspective on sexuality? I want to take a deeper look into my beliefs, and then I want to draw awareness to any negative thought that may arise in my mind and nip that in the bud, because I want to avoid all racist, all sexist comments, and not just that, but any racist or sexist undertone that may be in my voice or just in the back of my head. I don't want any of that, because that could impact my care in a negative way. Secondly, I want to give credit where credit is due. We learned that so many skills that's still used today in midwifery, and with OBGYNs, those skills can be traced back to indigenous and black and other cultural backgrounds. And so I want to make sure that's where the credit is, not necessarily with the white man, but where it actually originated. Third, I want to understand that exclusion, abuse, lack of autonomy, things like this that have occurred in history are still occurring to this day. I want to understand that there's possibly more deep-rooted issues at hand. I may have a client coming to me that says, my provider has discouraged me from conceiving, encouraged me to terminate my pregnancy. I feel like I lack the accommodation for my basic care, or my medical symptoms are ignored. Whatever that looks like, these issues are demeaning, they are scary, they are disrespectful, and those are the last things that I would want my client to experience and to feel. I don't want them to be treated like that. And so I will listen to them, actively listen to them, understand that that's their personal story, and I'm going to trust their story and take it as true, and then we're going to go from there. I know that everyone is uniquely different. I don't want to think about these stats and then take my client for what they are, what they identify as, and then kind of put them in this box that goes along with the stats. I know a lot of OBGYNs have done this before, where they see an African American woman enter their office and they automatically, mark their pregnancy as high risk. Or they see an indigenous woman come into their office and they're like, okay, another high risk. I don't want to do that. And I never will, because I know that everyone's experience is unique to themselves. And whether they look like a specific group or not, their experience could be completely different. And I really want to focus on that. I'll recognize that bias can be conscious or unconscious. So even if I don't know it's there, it could still be there. And so I want to be even more aware of every thought that comes into my head, and go from there in a positive way, making my client feel like they are special, like they are seen, they are heard, they are valued for who they are personally. My role is unconditional support. I'll trust my clients' personal experiences. I will sympathize with them, even if I have not experienced what they have experienced. I will put myself in their position. I will sympathize with them. I will meet them where they are at, and I will hold their hand through it. I want them to know that sometimes OBGYNs, they'll pose optional things as mandatory, and I really want all of my clients to know that they have options. It's not just one little thing that they have to stick to, but there's so many options. There's an array of options. I will offer you all of these options of care, and then you get to make that informed decision yourself. Regardless of what anyone else says, you'll get the education, you'll get the evidence, and then you make the decision that's best for you, best for your family, best for your body, best for your baby. I will offer care to all with full respect and equality. Equality meaning however many hours of care that you need, whether it's a lot or whether it's a little, I will offer that to you, and I will formulate a plan that fits you specifically, and we'll go from there. I will inform my clients that identify as a minority, that there are improperly trained OBGYNs, and that they may experience some negative backlash. And I want to let them know that ahead of time, so they go in to their appointments with their OBs, their midwives, nurses, whatever, with that in their minds, and they will ask a lot of questions. I want them to be encouraged to ask their providers questions. And then I will also be an advocate when your voice is muddled or overpowered. I will speak up. I will never speak for you, but I will speak with you, knowing what your values are, knowing what you desire. I will be an advocate for you. Lastly, I want to prioritize you and you alone, always over myself. And so whatever I'm feeling, if I'm having a bad day, whatever that looks like, I will not let that get in the way. And I will serve you exactly how you specifically need to be served. However, wherever, whenever you need to be served. That is what I will do, and that is how I will make you feel comfortable, how I will make you feel welcomed when you are seeking my services as a doula.